Good afternoon, everyone. Welcome to Peace, Mind, and Body. Our podcast is about healing and love and tea. I'm here with Sonia Borges, and she is a PT. And it's funny how we met. Um, Long story short, my husband and I are going to Million Cup in Woodbridge, and Sonia happened to be there, and I wasn't there. And my husband and Sonia met, and my husband said, "Oh yeah, you have to talk to my wife, who is a yoga teacher. I think you guys can work something else." And I called her. I guess when did I call you?
Yeah, you called me pretty quickly, like a few hours later, something like that. Yeah. So it was
Well,
a good
welcome to
taking
our
action.
show. I'm so glad we finally met and got to connect, and
Yeah.
here we are.
Yeah. Thank you for having me.
Oh, you're welcome. So tell me a little about Sonia. How is Sonia? What is she? Who is she?
Okay. So I'm a physical therapist, as you said. Um, I I'm also a mom, a wife, a daughter, a friend. All those things that a lot of people are, I guess. And who I am at my core, I feel like is just someone who I think this was something you had said at some point, which I thought is true. Like I just want to play, like I want to play in life, right? Like at my core, it's just like I get to obviously play with my kids. You try to play with your husband, have like a joyful relationship, and at work, I actually really enjoy my job. I don't think like everyone can say that. I know you enjoy your job as well.
I do, yeah.
And we're fortunate because I know a lot of people who just they wake up not wanting to go to work, and I'm the opposite. I get to play, like I get to like talk to people and create things, create exercises, create programs for them, and that's play to me. And so yeah, so at the that's part of who
Tell us. I
I get
remember
to
you
be.
telling me about your parents saying something about to take a route for different, like being a doctor or being in IT.
Oh
But
yes,
yeah,
yes, yes,
remember
yeah,
you
yeah.
told me,
Oh yeah,
yeah,
yeah. So very common, at least in my generation, with
in our
in Indian
culture
family, in our
and
culture.
Asian culture.
Yeah,
Yes,
yes. It's like you go to become a doctor, a lawyer, or someone in IT.
IT.
And I was very resistant to that. I didn't even want, and I didn't want to become a housewife. I just like all the things was just like, the more you insist, the more they resist. Like that was me. I was resisting a lot of things. And I eventually actually did a Myers Briggs test. It's a
Yeah.
personality test, for those of you who don't know. And I got ENTJ. So I forget all the different pieces of it, but it's like extroverted, and it'll give you examples of things you might like to do. And sometimes those examples might not fit you specifically within ENTJ, like in my case. So I think I got like accountant, manager, and physical therapist was a few examples. And I remember being accountant. I took an accounting class. Like that was nobody wants me as an accountant. And I loved math, but I was just not like that's just not my thing. And then manager made sense because my parents were business owners, so I grew to love that. They didn't want me to go on that path because it wasn't as secure. It's a lot of work, and
Yeah.
But here I am. I own a business now, and I love it because again, it's play to some degree, right? It's creating. And then I saw physical therapist, which I thought was interesting because all I'd ever heard about was like doctors and nurses and that sort of thing. And they deal with a lot of like fluids from at that time I was like I don't know I want to deal with that, and also just to me that was a little bit scary. And then I read into physical therapy. I'd never even heard of a physical therapist in my life before that test. And when I read it I was like, oh, this sounds interesting, this sounds cool. So that kind of led me down a path into that. Yeah.
What was the biggest challenge in physical therapy?
The biggest challenge is, I think, doing it the way things are designed sometimes. Like, I think, at least in the States, it's like we have insurance companies, we have those guidelines we have to like follow. And that can be very limiting in terms of what direction, like a healthcare company, because at the end of the day, they are still a business. You have to realize that is like they're still a business. So um, that and they have a lot more, like the bigger the company the more overhead, and
Yeah.
you as a practitioner might also be covering for other practices in some sense, right? Because it's never just like everyone is making the same amount or whatever. So that's a hurdle because you don't get to be as creative. And like I mentioned, that I just really enjoy being able to be flexible with this sort of thing. So I think that's one of the biggest hurdles is being a caregiver, trying to do what you want to do, probably what you went into school for doing. One of my first manager always said like nobody goes into healthcare just necessarily, at least not in physical therapy. You don't go to physical therapy to make money. You go into because you want to help people, and then you get there and there's the reality of how it's structured. So the hurdle is that structure sometimes trying to figure out how you can like work your way around it to do what you want with people, you know.
So tell me your journey to yoga.
For sure. Okay. Um, I don't. So I can't remember my exact first journey, right? But I just my let's say my overall journey is I've gone to, I guess different yoga classes, and I'm not like a consistent yoga practitioner. So that person in the class that you see who's like struggling, they're like trying to balance, and they're like everyone is like straight as a rod, and I'm like, just like shaking in the back. Like I would think I would, and I kind of make fun of myself. I'll be like, okay, there's everyone here doing like I don't know if tree pose is the right pose, the terminology, but doing a pose where you're supposed to be still and peaceful. And I'm like shaky tree and I'm like spazzing out in the background, trying to keep my balance. And I'm like, they're like, okay, now think about like peace and like, be calm. And I'm like, I'm trying to balance, So, but I would say my big aha with yoga was actually when I was in PT school, learning about different exercises and movement, and then coming across sun salutation, right? From a PT perspective, I was like, that is so crazy. Like, some of this stuff was created like years and years and years ago,
Yeah.
and yet they didn't have a textbook that they were studying from. I don't know to what extent they studied anatomy at that point, but it wasn't like me. I went to school, someone handed me a textbook. You're looking at slides on a PowerPoint, and that's how you're learning about these different motions. But sun salutation, we talk about planes of motion, like the directions that you move and the muscles you move in those directions. And
Internal and external.
yes,
Yeah.
yes, exactly. Yeah, and like you'll affect your quads, you'll get your abs, you get your arms, your back through that. So sun salutation actually hits all of those points. So I was always like, and I'm still curious. There's still a lot for me to learn. You've taught me some too, right? So it's amazing what people have developed over time, and now we're like, oh, we have research that this is true, but like back then they didn't have like a research article to say. People would just do it, and it was effective.
Right.
And I'm just talking about it from a physical anatomy perspective, even.
So do you think yoga's changed your view from a gym to a studio like this one?
Yeah, yeah, I think so. Another area I'm still learning about it. That's there are different types of yoga, and
Mm-hmm.
I think a lot of the gym classes they're just more structured. They're I guess you could say some are franchise, right? And it's more about I guess in my world it's like where it's more about like the anatomy, and it's like let's just get this movement done. And I did a class here. I think that's an example I can use, right? So I came into the class and it's a little bit more relaxed. It's a little less like, let's try to hit this goal. Let's try to hit this mark. It was everyone you could tell was at a different point, including I was still that person in the class, shaky tree.
She was good, by the way.
But, oh,
She's
thank
being
you.
hard on herself.
Thank you. So it was more
And
just
she was not the shaky
relaxed.
tree.
Oh, good. Thank you. I tried. I was trying. Yeah. So but yeah, I think this class, it's more, and if you're looking for something a little bit more spiritual too, and you're able to get to that place, whether it's just that you want peace, I think, because that can be separate for people, right? For
Mm-hmm.
some people, it's just like a mindset, but then some people it's spiritual, and then some people it's like an overlap.
Exactly. You
Yeah.
hit it. She hit it. Yes. What you're looking for yoga, either physical, spiritual, or both, and we do that here. We hit anything that you want. I think yoga for me, it opened who I am.
Hmm.
It opened my right side brain more.
Hmm.
Um, and I'm still learning and growing. It doesn't. There's so much to know about yoga. There's so much philosophy,
Yes.
and it's
Yes.
from my perspective, I would love to go to India and get we spent like almost 6 months just viewing and being with the inspiration person to guide me in that direction as well. But that time will come. I don't know when, but it will.
Yeah, no, that would be
That
awesome.
would be, yeah, it would my one of my dreams come true. Um, Tell me about the time when yoga um, helped you breathe. I think you were telling me you just had a baby
Hmm.
and um, you would they were asking you to take a couple of tests. How did that happen, or how did you find out about your
Hmm.
breathing? You weren't breathing enough. You were needing enough. So tell us that experience.
Yeah, I think so that's one of the things. I think so when you so I have two babies and I had them a little back to back. So my body definitely took there was a lot going on with my body, right? So the first time, I guess for those of you who don't know, it's like the first time I was you've been exercising, you've been moving, your body has built a certain um, stability and structure and strength over time. And then the second time for me, it was so back to back, my body didn't really get a chance to recover fully and such.
Mm.
But in terms of breathing too, the first time it was like it took long. They tell you it takes longer to have your baby, right? So there I was probably breathing more, trying to work on my breathing, and they encourage you to do so because I know I have a tendency to hold my breath sometimes when I'm stressed
Mm.
and I don't even realize I'm doing it until I go and I'm like, oh, okay.
Oh, I
Yeah,
get a breath.
yeah, exactly. And the second time was more in fear because my second baby came so fast. My first one was late, and my second one was like a little bit early, and so it was. You have to be able to control your body, and a lot of people actually will fight this idea that I just have these thoughts and this, that this and there's it just happening to me. So I think yoga is one of those things where you do have to think about like what can I do, what do I have control over, that sort of thing. And then and in that situation, there's things you can have control over where you can breathe and you can actually calm down you calm yourself down because you want to calm yourself down for yourself and also for your baby, right? And for me, sometimes like the people near me, the first time my mom was there, so I was like, I gotta, yeah, I gotta stay cool to keep my mom. I want her to be cool too. Um, but yeah, just being able to just calm your body down so you can actually focus on, pushing the baby out or whatever is because everyone's pregnancy is different. Whatever you need to do, breath work is really important and finding peace and that sort of mindset that you would learn in yoga is actually applicable to situations you wouldn't think. You don't think yoga necessarily when you're in delivery, right? You're
Right.
just
Yeah.
like,
Yeah.
yeah.
Breathing. Um, so after having the baby, did you have any postpartum depression? Did you
Hmm.
feel like you did, or how did you?
Yeah, yeah. So my first baby, I had postpartum depression, and I didn't even realize it for about 6 weeks until I went to his pediatrician gave me a test, it's just standard practice for that practice. And I was like, oh, I thought this was normal. I thought it was just kind of like because everyone talks about, oh, you lose sleep, you feel miserable, da 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 da. So I was like, oh, this is normal. Then I went there and they're like, oh no, this is not normal,
Uh,
And my second one, I had prepartum, I guess, depression. And that one was actually worse because my babies were back to back. My hormones weren't like regulated yet, that sort of thing.
so what did you
And
do
so,
to help you
yes.
recover?
So, yeah, that's the thing. I think that in order to really take care of yourself, especially I'm someone who I don't like to go towards medication because the doctors, and with their best intentions, they're like, do you want some medication for this to make you feel better, that sort of thing. And I always want to, because I've met so many patients over the years. It's becoming more of a trend now. People are just coming away from the medication because now we have all the research and information and just seeing what other people are going through that you want to try to stay away from it because there's so many side effects. um, and so once I had that awareness that no, this is not normal. You don't have to push through it. You don't just have to deal with it. It does come back to like I guess what yoga does too is that you're centering yourself, right? So you have to be in the moment. We were talking about this earlier, being in the moment and just saying what's going on right now and getting yourself into
Yeah.
a
What
position. Yeah.
basically think of five things.
Hmm.
what do I see? What do I hear? What do I feel? Is my breath with me? That puts you into a centering in the moment.
Hmm.
And Sonia and I are talking about her practice that she wants to help caregivers, right?
Yes, yes,
So
yeah.
tell us what do you mean by caregiver? Who are the caregivers that you want to talk
Oh yeah,
about?
yeah. So caregivers can be anyone. Really, there's people who obviously care for their kids. You might be a caregiver for like your parents. You might just be a caregiver for someone who has special needs, or
A
there's
mom with moms who have special needs as well. They
yes,
yeah, they definitely need some time to, and a lot of women don't ask for help, and that's what we're Sonia and I are
yeah,
talking about. Asking help is not feeling you're you're not good enough. Asking for help is helping you as well as transition to your lifestyle. And
yeah. That was one of the things that I had to keep reminding myself, because I say it to my patients, but like I don't remember. You have to work on it yourself too, right? Like it's a thing. So um, yeah, because there's a lot of guilt. You get it from yourself, or you get it from the outside coming in.
Mhm.
Um, so there's guilt, there's fear. Especially with my first child, I had a lot of just fear of like, oh my gosh, what if this happens? Oh my gosh, what if someone kidnaps him? Oh my gosh, this. Oh my gosh, that. And so that is not helping you even serve them, right? And so there's just a lot of different factors that come along with being a caregiver that you have to work towards. And so for me, I work with people physically, right? So I help them with lifting, making sure that they're not in so much pain when they're doing some of this stuff, because they have to do everything from lifting heavy groceries to helping the person transition in and out of bed, things like
that's
that.
really
Yeah.
the transition is, helping an elderly person. If you're not using proper muscle or using your knees and twisting and yes.
Yeah. And then there's also the like, you could probably speak to it more, is just the mindfulness part of it, because even if you're doing your exercises, for example, say if you came in for neck pain, you're doing your neck exercises and everything, but if you don't have your mind in the right position, then you're still going to have that neck tension from just being so stressed and not being able to, like you were saying, like be in the moment and such.
Yeah, always go back to those five senses, or just when you have that negative thoughts or going in, um, try to get your snap breath in, breath out. What do I see? What do I feel? What is my, go back to your heart beating and a smell, taste, the wind blowing in your face. That also gets you triggered to back into the moment and use that as your anchor too, I would say.
Yeah,
Yeah.
yeah. I think that's the thing with being a caregiver too. It's like you have to keep, your stress, your physical stress, your mental stress can like be up here, and you may never get down to like, oh, totally calm, but it's important to try to at least work on it, because I think if you think in the long term, if you think of your life, all those little things start to stack up and take wear and tear on your body, and you want to catch yourself in those moments
Mm-hmm.
physically and mentally.
Mm-hmm. And tell me about your growth in your business. What are your dreams and goals for what you want to do?
Yeah. So my goal has been to really be, um, I guess, to get people more personally, and that's really what most physical therapists do. Honestly, they get into it so they can spend time with people and really get them educated and help them know how their body moves and such. And so, obviously incorporating that. And then for me, I'm starting to see more of like the importance of just focusing on the wellness thing, which is technically what physical therapists are supposed to do, but when it comes to like traditionally, I don't know if traditional is the right word, but what happens in like a lot of offices is you come in, I have neck pain, and like, okay, let's fix your neck pain, and then that's it. But the bigger picture of like, well, what are you going to get back to? What do you have to change in your lifestyle? That sort of thing, is really what I want to start honing into a bit more, so that people can, they don't have to come back to me. Like honestly, it's like you hear sometimes people say like, oh, they want more business and that sort of thing. The thing with physical therapy works out for us in a sense is that people always have injuries or they have something, but I don't really want to come. I really don't want people to come back to me for the same thing. I want them to come back to me for something else or an advancement of like maybe what they're doing. If they came in for pain for one thing, but then the next time they're like, oh, I want lifting teach me about lifting, right? So it's that sort of thing to make it personal and make it longer lasting is really what I want to do. And it could look like I like to do like an online platform where I'm educating, whether it's like a what do they call it, on demand or like live, that sort of thing.
It sounds that.
And then continue treating to I really enjoy what I do, like I mentioned.
Mm.
Yeah.
What does peace mean to you?
Peace. Okay, so peace to me just means um, just I think in some sense like enjoying who you are.
Yeah.
Because I think when you enjoy who you are, you're not stressed with what's going on around you, and when you're enjoying who you are, you bring that out around
It's
you.
a peace within you.
So
I
peace
love
within
that.
you.
Yeah, peace
Yes.
within you because
Yeah.
yeah, it brings it out to you.
Yes.
Complete this sentence. Yoga has taught me.
Mm-hmm. Yoga has taught me about I guess it goes back to being in the moment, but just and peace, honestly. Not to just like reiterate, but
No, no, we
it's
yeah,
yeah,
it pieces. It's inside. We just have to use that moment to breathe
yeah.
in the moment. That's it.
And I think like you should like the feeling I get, and it seems like I'm being biased because I'm here, but really it's like when you walk in here, you feel like peace. Like you walk in, you're supposed to be in like a peaceful mode, which is it's almost funny. It's like you walk in the door and you're like, oh, okay. I saw this sign online that said, watch what energy you bring into this space or something like that, and I was like, oh yeah, that's so true. Like you want to bring you walk in here, you don't want to be like, oh, all this stuff. You're like, oh, I'm here to work on getting my mindset to be like what it is when I'm in here, so you can't really just keep sitting there. One of the things I want to incorporate into my office is like have a sticky pad there for people when they come in. Someone did this in a yoga class, actually. I'm pretty sure it was a yoga class. They handed us all sticky notes, and they had us write down anything that might distract us during the class, and then you put it aside. And then if you're doing something and you're really like, I can't stop thinking about that, you pick it up again. You can write on it, but it's that idea of just being there, going back to like being present. So yeah,
That's good.
yeah.
Yeah, very nice. All right, where can our viewers find you?
So you can find me at revampphysicaltherapy.net. And on social media, I'm revamp.physical.therapy. So right now I'm on Instagram, TikTok, and Facebook. So
And we'll have her information on the description.
yes.
Thank you, Sonia.
Yes,
for
thank you.
having you on here in such a short time, and I really appreciate you. So today's tea we have jasmine helps your core, and this is tea with jasmine, lavender, and peppermint. And thank you again for coming.
Thank you.
See you next time. Love and light to you, my friends.
Thank you.